Hi everyone. Before I discuss this next case, if you can look through some of my past videos related to kids' health, related to infant health, some of which I made in English, some of which I made in Hindi, and women's health, it might help you understand deeper where I am going, possibly. But I will try to readdress some of the same issues I have mentioned in my past video before I discuss this next case, which is a real life case that is unfolding right now in US. And while my history, part of my patient history, of all the observable health problems that I understand about my own health happened in recent years in India. I also want people to understand that many of my health condition related factors that influence my health, I think this is why the universe wants me to do this, part of my life journey of my adult health related symptoms were also happening to me while I lived in US. I have lived 13 years of my adult life in US and the rest of the years of my adult life in India and rest of the years of my childhood in India. So about a quarter of my life was, and especially nearly a half of my adult life was spent in US. And in those times I was a healthcare practitioner also in US, so I was mindfully following some preventative care strategies also to stay healthy both in US and in India, even when I was working as a pharmacist, not working in any healthcare field. Then also certain health and safety related things I was doing all my life. So, firstly, let me just give you a brief introduction of what work I did in US, because that might give you some context as to why I talk about these wide range topics. In US, I worked initially I was a PhD student, but because of some different challenges that were going on in my life, I failed the PhD exams, but I've passed out with masters. But because I was a PhD student, I had many friends who were also PhD students, both American friends and Indian friends, and they were PhD students in different programs, not simply the program I studied. As a result, I am familiar with the work that PhD students do. Very superficially I am familiar because I've only very rarely attended any of the PhD qualifying exams or PhD thesis presentations of some of my friends and colleagues. But I have indeed seen what kind of PhD level work is done in US, to have the familiarity of what US students do when they are in the PhD program and the level of attention and details that a PhD student has to have when they are studying PhD in US. Secondly, after that, and I had about 3 years of personal work experience related, personal study related experiences with other students when I was initially a PhD student and then became a master student. But other than the professional exposure that I was having as part of the PhD program in that university, I had also personal life experiences because many of my good friends in US were PhD students, and not simply in my field, but from engineering to medicine to pharmacology to biochemistry to micromolecular biology. These are all the degree programs, friendships that I have held in US, to understand briefly but enough to know a little bit more about what kind of work some of these students do in their relevant associated fields. And this is important possibly when you will understand when I give the context about all this later on in the video. Then after doing that work, when I failed the program, I lost my earnings as a result of a PhD, whatever I was getting to work as a PhD student, as a research student in US. I was working in a lab, so that part got lost for me, so I had to find alternate source of income because I didn't have any income. At that point of time, I had tried to join another lab. It didn't work out, but instead I got a job in a preschool as a teaching assistant in a preschool. And that was as an aide or an assistant there. I was also exposed to child caretaking there because it was a preschool. So the kids in our preschool were ranging from 2 years age to about possibly 5 or 6 years. I didn't work that much in the older classes, but in that older class, I knew some of the children were partly daycare students, partly preschool students. So they were older than 5 years in that classroom. But when I was working in the 2-year-old classroom, where again I was not like, I was mostly working in a 3-year-old classroom or working in the kitchen of that preschool. So in both these places, health is important, health caretaking is important. And when in 2-year-old classroom, because they are young babies or toddlers, some of them also needed diaper changing. So I was familiar with diaper changing in that preschool. And in my personal life, while I have babysitting some of my, or like not babysitting exactly, but because none of my friends have completely left me in the care of their kids for a long time, but some of my friends and some of my family, I'm a very house bound person, so I like enjoy spending time with my friends who have kids. So sometimes they've left me, like I've gone and visited a friend in her house sometimes while doing some, I was doing a doctoral program, another doctoral program towards the tail end of my years in US. In that doctoral program, I had finished 1 year of the study, and the second year I didn't finish because of visa issues, and I put it on hold, but I never could finish that program. But again, there I was exposed to another doctoral level set of students who do doctorate of pharmacy degree, where clinical pharmacy practices, clinical practices related to healthcare are studied there, where deeper diving of patient data, deeper diving of patients' clinical symptoms, health symptoms is studied. That's why only I have that experience that leads me to talk about some of the clinical parameters related to clinical diagnostic things that could be tested, that could be changed, that needs to be changed or understood or scrutinized more deeply in my previous videos. And then in the middle section of my life in US, and at that time it was the tail end of my life in US, some of my friends had smaller babies, and I would occasionally go and either hang around in their home for vacation, or they would invite me over because they were also lonely. So I would come over in the daytime and stay in my friend's home either half a day or for 2 days in a row. And because they had enough room in their homes to give me a new bed, I would sleep in their other room where guests would sleep. While in the daytime, when a mother is a very busy mother and she has a baby, but she needs, like, it's very difficult when you are, even if you are a full-time mother and stay-at-home mom, at that time also you are busy. When you are a part-time mother, like you are putting your children in the daycare and then the rest of the day you are spending with your child, that can and in the daytime you're working, and then at home you have to take care of the child. I've seen both kinds of friends who have been really busy with child caretaking, where either the whole day they are at home or part of the day they are at home taking care of the child. And then as a preschool teacher, obviously I have seen what teachers do in a preschool when a child is there in a daycare or preschool setting. So this is the context of my children's health related context that I have had. And in my friends' homes, I would sometimes, when my friend is going to the bathroom for half an hour bathroom break or taking a shower, that is the maximum time period I have been left to monitor a child. But I used to find it very nerve-wracking, especially when my friends' kids, one of my friends' kids, ever since the child was born, from the first week of her birth only, and until about the time they left the state, many months I have spent, or days I have spent in the friend's home. Like, we used to celebrate the child's 1 week birthday, 2 week birthday, 1 month birthday, 2 months birthday, like that 4-5 times we just celebrated some markers of the child's life, because that was like the first child all of us were very close to in our life, and we would all hang out together as a friends group. Just for us also it was fun because we were hanging out with a small kid, and our friends were very hospitable, so they would cook yummy foods for us, or we would order foods for each other. And for celebrations we would buy cakes. Obviously we would never feed a small 6-month-old baby any cakes, but for the 1 month celebration, 6-week celebration, like that, some months of celebration we had done when a group of us were together in the same city for a same time. And then of course everyone's life diverged, so some people moved out, and then the celebrations weren't as often as it was in the beginning. But anytime we would go for those celebration things, I've seen how a child is raised in the home also of a normal typical, they were doing all normal typical American things in their homes. So they had a baby bouncer, they had a baby's swing, they had a baby seat where the baby would be strapped and put on the seat for feeding the baby. And about until 6 months or 1 year of the baby's life journey, slowly over many months, or it's like maybe from the time the child was born to the time the child turned 1, there were at least 5, 6, 7 days where I have stayed the whole day with the mother and the child, or spent 4 5 hours with the mother and the child and other friends. Or occasionally they have also had parties or other things, where parties meaning just normal socializing, where before the child was born we used to do a lot of socializing and potluck related activities. So I was very familiar with my friends' patterns of behavior, how she does child caretaking. She was familiar with me, and we were that much level good friends that if I'm uncomfortable doing something while taking care of the child, she would understand it, knowing that I don't have a child myself that I'm raising by myself. Even though I had 10 years back the experience of working in a preschool, or 8 years back the experience of working in a preschool. It's very different to take care of a child in a preschool, because the child who's there in a preschool is above 2 years. They are able to at least walk. Some of those children are also able to wear their own coats and don't need that much help, whereas a baby needs to be carried around, needs a lot of help, and they have softer brain development happening. So I used to be very nervous when my friend's baby was only 6 weeks old or 2 weeks old. We tried to take pictures with the baby on our hand, and we were collecting memories, because it was a new thing for all of us. We were having fun collecting memories and taking photographs of the child and the whole group and everything. So at those time points I would be very nervous holding a 1 week, 2 week, or even when she was 1 month old, I used to be very nervous holding her. The time when I was really comfortable holding a baby was when the baby was a little bit less floppy when the head, because I used to get very nervous with the floppiness of a baby's head. And when I held the baby, I could see like some of my friends were much more comfortable holding a baby in the right way. They knew how to hold the baby without the baby flopping their head or shaking their head, whereas when I was holding the baby, I was just holding them in such a wrong way that I knew I was not holding it the right way, and I got scared that I don't want to hold a baby that delicate. So I would always, after only holding the baby for a few seconds, I would give away the baby back to the parents. And a 6 months or 1 year old baby, or when she was also after she started crawling, until like about 2 years I knew this baby. So in all those years of her developmental stages, every few months I might visit them and hang around with them. So I had seen the developmental phases of the child's life, and the developmental things that the parents are slowly transitioning as they are as the baby is going from a baby being held by the mother to the baby being put on a chair for feeding when it's 6 months or 1 year and things like that. But in all those moments, and then there was another friend of mine whose baby also I hung around with after the baby turned 1 year, 2 years of age. And in that friend's house also the same thing, I saw the transition of her baby also, a little less of the younger baby stages of her child, but more of the older babies and toddler stages of that child also I used to be very familiar with, because once in 6 months or a year I used to visit that family also as a during vacation time and things like that, because my other friend used to live in a different city. So less often visits were possible with that friend's home life. But I used to stay long term in their homes. And in both these children's cases, my one problem with those children, when one time it had happened, my friend asked, can you help with unstrapping the child from the back seat, because she had at that time I think 2 children. So she wanted me to help with one of the children. So while she told me to help with the children, I was like very befuddled and puzzled how to work with the mechanics of the strap of the stroller and car seat like thing that she had in her car. So it was a joint stroller car seat type mechanism that she had. Whatever it was, 2-3 times, and there was another baby also who I had one time lived with their parents also for a few weeks. So like that I had exposure to in personal life in US three or four Indian families who had toddler stage or infant stage kids in their homes. And when I have lived in their homes and assisted them occasionally with minor child caretaking activities, very minor, because it was not a very, I'm not the primary caretaker at that time, I'm just doing or following what the parent is asking me to do. I was doing that level caretaking. So at that point of time, when they told me to unstrap the child in one instance from the car seat, I found it a little puzzling. I didn't know how to unstrap it. In another instant, another friend asked me to strap a child, and again I got confused with how to strap a child. And has it ever happened to any of you as an adult also, if you are sitting in the car of another friend and you are in the back seat of a car, or you are taking a Lyft ride or Uber ride or a normal taxi ride, at those times also, sometimes what happens is when we are sitting in a car and we know we have to put a seat belt, but either if their seat belt has a different functional mechanism than what you are used to in your car, you will have a hard time clicking it. Like if you are functionally challenged like that, sometimes you will have a hard time figuring out how to click the car seat in the right way. And I've done all these silly mistakes many a times. Sometimes their car seat system is only not working, so if you try to close and click the car seat, fix the car seat in the right way, because there's some malfunction going on with the car seat system, it will not lock. Sometimes that can happen. Sometimes if there's no malfunction going on, I have done this, and in airplanes also sometimes this happens, that instead of trying to put it in your seat's clicker, I don't know what are these two parts called, but the part that goes inside that clicker thing, if you picked up, instead of your clicker, you picked up the clicker of the neighboring seat, again it will not fit into the neighboring seat's clicker, because it is not the right seat, right? So like that in the car or airplane also, I have had these occasional mishaps where I'm not fixing it to the right thing. So either you don't, the reason why this is important is because in all kinds of these car seat like mechanisms, when you are not a frequent traveler, and I became better with car seats and better with airplane flying seats, the more I made such mistakes. So like after 2-3 times of making these silly mistakes of fixing my belt in the wrong seat's clicker, or not understanding how to fix my own belt in the right way, after a couple of times of doing all these silly mistakes, then I became more proficient at it and better at it the more I traveled. So if I have, after the when in the first 2-3 years of traveling I have done those silly mistakes, after 10 times of traveling in the airplane, I don't make those mistakes. And then again, though, is it possible that even after you've become a frequent flyer, for you to make that mistake? Yes, it is again possible. When the first time you make a mistake, it is possible. The first time you made a mistake, you're unfamiliar with where the airplane seat belt goes, how to fix it, which is your seat's clicker and which is the neighboring seat's one. That can happen. It can also happen when you are not just unfamiliar with the whole system, but when you are not paying attention. And that has happened also to me. Like even after flying 10 times, 20 times, I have sometimes forgotten and not been paying attention, and by mistake use the wrong seat belt and try to fix it again in the wrong one. So these things that can happen to us if we don't pay attention, if we are unfamiliar with things. And then finally, if you have a malfunctioning device, then also even if you try, if you are they are both supposed to be part A and part B are both supposed to go and get fixed with each other, but the manufacturer has some defect, then also things will not be able to fix together with each other. And these things are crucial, important things in the next cases story that I'm going to discuss. That's why I'm discussing here in this video. Okay, so now I shifted this because this is all my experience of living in US, traveling in US. I used to travel multiple times, either for visiting friends in US or family in US, or just traveling with friends in certain during vacation time somewhere, or sometimes when I was traveling from US to India and I was doing international traveling, all these types of issues have cropped up for me. And when living in US, in my friends when my friends were living in US, they have used all the baby seats, baby car seats, baby strollers that is easily sold in US by multiple manufacturers in those cities where I visited them or where my friends lived. And in those cities, when I'm unfamiliar with the device, if they asked me to take a child from the car seat, and if I'm having a trouble, I would tell my friend I don't know how to do it. Or let's say, one time my friend told me, can you fix this? And I tried to fix it, and I thought that I had locked the car seat thing properly, but it turned out that the way I locked it, and I heard a clicking sound. So because most of the time with the car seat related things or a baby stroller related things, you will hear a clicking sound when something fits in properly, right? So I heard a plastic clicking sound, and I thought that this seat, I had secured the baby well in the car seat. But I didn't know, with babies in the car seat, while with adults in the car seat, you just need one mechanism to click and that's it, and you're fixed in the car. With babies, when it is a baby bouncer or a baby stroller or a baby chair, high chair where they eat their food, in all of these mechanisms in which babies can be put for put down in all of these, if you don't know, sometimes there are not just one thing that needs to be clicked and fixed, 2-3 different things need to be clicked and fixed. And if you don't put 2-3 of these things together, the child will not be secure in that thing. So this thing, I had made some mistake now, and I'm so the way I'm speaking will sound very silly because I'm not very familiar with all the mechanical names of these things, or because it's been almost 13-14 years since I have even been exposed to these kind of mechanisms. I don't even know what these are called anymore, or what is the development thing that has happened in recent years with these baby bouncer and car seat and car stroller like strappings and things like that. So I'm talking in a very layman's terms and very uneducated term about it. But I hope you understand, anyone who was a new parent, anyone who has ever babysat a child on behalf of someone else occasionally, everyone can be a little slightly unfamiliar with how these gadgets work. And if you're not very mechanically oriented, you may also find it a very distressful thing to learn initially. If you're not used to doing it, it will take you some time to learn it. And I was that kind of a person. And though I had so many 4-5 friends, children's related experiences related to car seat or high chair or bouncer or stroller related experiences with my friends, I was more an observational person than the person who was actively participating in it. My active participation used to be either holding the kid, or sometimes occasionally feeding the kid, or simply being a monitor for the kid sitting in front of the kid while the parent is doing some activity. So I'm not I'm maybe playing a nursery rhyme with them, watching a nursery rhyme with them. So I was a very assistant monitor of a kid rather than an active participant in deeper child caretaking things for the kid. Right? So which is a very different thing. When you're an assistant caretaker of a child, you are not very deeply understanding many things about deeper child caretaking at that point of time, which is important for the next case. And then finally, I'm going to talk about some issues that I faced in India in recent years. These were issues I was possibly facing in US also, just that I hadn't put 2 and 2 together. At that time, I was not familiar with how these things were impacting my health. Because what happened to me in recent years in India is that I observed there were many things that I've observed have been impacting my menstrual flow, and I have made a women's reproductive health video related to this. I don't know how deeply I had discussed in that video about this issue, but what was happening was there are many food sources that were increasing my period flow. There are many hormonal changes that can increase your period flow or duration of your periods. And then final factor is toxins in your food or products you use can also influence your menstrual blood flow, the, like, if say you used to have periods for 3 days in a month, now because some toxin is there in your pad. And for me, one of the things I found was period pads, period panties which look like diaper like panties. These and they are made only of materials that baby diapers or adult diapers are going to be made of. All of these things, period menstrual pads, panties and diaper like things, or even the thinner period liner, panty liners, all of these I have experimented with and used multiple brands in India. And with all of these brands, some very rare brands are there in recent years that I have found that my body is not reacting to the chemical or material content of that pad. So either there is some chemical dye that has been used in these pads, or the material itself that is used in these pads, or the places where these pads are getting manufactured, some kind of cross contamination might be happening in those places, or some kind of deliberate chemicals have been added to apparently make the pad hygienic, but that chemical is actually not hygienic, it is health harming for me. So as a result, what has happened is, if I have access to a clean pad which doesn't cause any reaction or health problems, I will have normal 5-day periods of a kind of blood flow that I used to have even 30 years back when I was a teen and or a 20-year-old. And at those times also, as a teen or a 20-year-old, the kind of blood flow I had, the kind of normal flow I had, that same level of normal flow is happening to me currently. But if the pad is got some chemical consistency or dye or something else going on wrong with it, that is not aligning with my health, that is not good for my health. If normally, let's say I get 5-day periods, and in 5-day periods I get 2 days of heavy blood flow, or 3 days of 2 to 3 days of heavy to moderate blood flow, and 2 days of lighter blood flow, this was my normal period cycle like consistency. But whenever there is high toxin in the pad I'm using, what is happening is, instead of those 2 days only of heavy flow, 2 days of moderate flow, 1-2 days of lighter flow, this was like a rough a little bit here and there change would happen every month. I was not like a machine that every month it will be 2 days heavy, 2 days light, 2 days 1 day intermediate. It's not like that. It's a little intermediate combination is going on, right? But it was 5 days like that. But when something more toxic is getting exposed via my vaginal area and it's getting absorbed by me, because while period blood is coming out from my reproductive organs and it's getting stuck on the pad, anything that is there on the pad also, because the pad is wet from the blood flow and because blood is going down my body, but that same blood is also connected in a stream and my body is damp at that time. I could be also sweating as a result of other hormonal things going on, all of which means my body has a very absorptive capacity at that time. So anything in that material that is toxic to my health will be getting may or may not be toxic, but any chemical on it can get absorbed by me, and if it is toxic, it will obviously cause a response related to the toxic exposure. Some of the responses which some of us get when we use period pads or tampons or any other period material is related to allergies, and the simplest allergy that most of us get is we will have red rashes or swelling in that period area in the pelvic zone, right? So you will get rashes, you will get skin irritation, you will get redness, you will have pain in that skin of that area. All of these are symptoms I have faced in the past when only minor level irritation was going on. But when it is a major level toxin exposure that is going on, at that point of time, in these, instead of 5 days of period, sometimes I'm having more increased days of periods, and instead of 5 days where only 2 days are heavy flow, I'm now having 3 or 4 more increase in heavy flow as well. because people don't realize this, but our blood that gets emitted out from our reproductive organ, while part of it is that uterine cells are shedding and new cells are being built and blood is flowing out of our body, but part of it is also along with that blood, whenever the blood is flowing out, like when we pee out urine or poop out poop, at that time when our excretory system or renal system, our liver helps in detoxing solid waste from our body, and that solid waste content has some toxins also in that solid waste if some toxin consumption has happened in our body. Same way, when we pee urine, liquid waste is getting peed out from our urinary system whenever some toxins are there in our body that are easily expelled by liquid waste. And that liquid waste doesn't simply get passed out from our body via the urine, it also gets detoxed from our body via sweat. So that's why only when people have pesticide poisoning, one symptom of chronic or acute poisoning includes people having urinary problems, includes people having poop related problems, diarrhea related problems, includes people having watery eyes or excess sweating or even drooling, because these are all the mechanisms via which the body is trying to expel out all the chemical toxin that is in case of pesticides, it's the chemical pesticide that has been expelled out. And in case of now our period pads or any diaper like materials which we might be used by not simply women but any adults or children as well who have similar period pad like material is getting used by them for their diaper related purposes, understand that those absorptive materials that absorb out our pee, absorb out our poop, absorb out our blood, those materials can also, if they have some toxin in it, that toxin is also, while we are wearing that device, like if it is a pad or a panty or a diaper, whenever we are wearing it, any human being who is using such a thing, whenever you're wearing it, it is absorbing the chemicals from that, like how my cloth chemicals can be absorbed by my body, similarly the pad chemicals or other contents or diaper chemicals or other contents can be also absorbed by our pelvic area. And the initial symptoms of the absorption, when if we are in a healthy status and this is why I am saying that these problems of excess blood flow was happening with me when I was in US in my 30s, but at that time I didn't correlate it to period pads because of the simple fact that at that point I was not aware that period pads was also a cause of this excess periods. I just thought it was either hormonal changes that was causing it, and secondary reason I finally figured out was because of excess pesticide exposure in my homes that were also leading to it. Then there was also hormonal changes because of soy products. I was also doing some dieting related changes, so I had changed my diet into using a lot of soy protein products for health purposes, like many of our protein drinks and protein Weight Watchers or Protein X types products or other protein supplemental granola bars and things like that, or milkshakes or other shakes that are available for diet purposes, for health reasons and nutritional reasons in US. They all many of those products were made of soy proteins, and because my soy protein content had increased suddenly in a mass amount, I attributed my increase in periods to that. And it was a true fact. It's like with baby Uriel's case, where I'm saying that multiple factors were responsible for her health decline. So for any particular one health symptom change in your body, again multiple factors could be responsible for that health symptom increase. So slowly only after process of elimination, I understood what was causing my increase in periods. And initially when I didn't know what was causing these increase in period flow, increase in duration of periods, at that point of time, what was the strategy that was used? I went to a doctor. The doctor knew a medical maid to change that. So they prescribed me a medicine. After taking that medicine, my blood flow got regulated to such that earlier I was at that point of time in my early to mid 30s, I had started having period flow of instead of having periods every 28 days, my duration had reduced, meaning I was getting more frequent periods. So now earlier in a month I was having once a month period, technically most of the time once a month period. Occasionally in some months, if on first of the month I had period, by 28th I will again get period in that month, but otherwise it was once a month period. Whereas when my period duration has now shifted, or the time at which I'm getting the period is happening sooner, now it started happening that because of that sooner advent of the period, now I can have periods in 2 months span. 3 or 4 times I could end up having periods. So that was a more frequent periods were happening. But as soon as I got the hormonal medications to balance my hormones in my body, again because of the hormonal medications I was prescribed, my periods became normal flow. But because other factors were also there, and because these medicines that were prescribed to me had some side effects associated with them, the side effects which I didn't want to get by continuously taking the medication, and then after a few years I had also changed countries, where in India any replacement medication that I tried were also causing much more severe side effects. I had to slowly figure out. In US only I had started figuring out what are the other nutrition related factors that were impacting my health. So the nutrition related factor related to soy protein, when I discovered, I realized that I shouldn't consume that heavily soy proteins. So anytime, when women go into diets and at that time we consume a lot of heavy soy protein products, you will observe, if you are having heavy period flow or change in your period where longer period flow is happening, you can try out this to ensure that your period flow doesn't stay that long. If soy protein was responsible for imbalancing your hormones, reducing the soy protein content and shifting it to some other protein source will help you possibly with the period related problems. So that was one thing that helped me when I was in US. That time only I started cutting down my increased soy protein intake, and I became again into a normal soy protein usage. Because the time when I got this heavy flow, that is the exact time when for 2, 3, 4 years I was consuming a lot of heavy soy protein. And before that my soy protein consumption was only once a year or once in 3, 4 years. That was my soy protein content consumption. So if you live in a country where you have always been taking soy protein, this may not happen to you because your body is used to that soy protein. But if you are unusually taking soy protein, suddenly a large scale amount of it than what you used to previously take, that is when its sudden health impact can happen on you, which is what happened to me. So I had to reduce the soy protein, and immediately my periods started slowly shifting and getting into a more normal zone. And then the second thing was pesticide exposure. That the pesticide exposure related impact on periods I understood more deeply when it happened to me again in India as well. So 2 times repeat of the same thing led me to understand better what was happening with the pesticide. And same way with the period pads, now in US there are some laws, because of which safety laws, which causes some of these period pads. And at least 15 years back, 20 years back, the type of period pads I used to use in US as well as in India, none of them used to give me any kind of heavy unusual blood flow. But in recent years, many period pads have been giving, many diaper like materials which are period panties that I use is exactly like a diaper material. So all of them have been giving extreme rashes, not just skin irritation rashes, but also heavy period flow. And the moment I don't use those materials, my period flow instantly gets down to a lower level, because like how our poop and pee and sweat is sweating out toxins in a woman's biological system. Another way to detox from the body is via the periods. Like, because your period, if any time I'm absorbing toxin, again the body wants to release it out. The period flow is a way to release toxins from your body also, and which is what I've explained in another video. I may again explain it in another video conceptually, this concept, because many people don't realize it. The research work needs to be done on this topic a little bit more deeply. What I'm presenting here is some intuitive things that have happened with me, which needs possibly some more deeper correlational research too, for those people who want better scientific evidence, and for those people for understanding this at a greater impact level for many women, right? But this is also a true thing. If period materials are getting impacted by certain conditions related to either manufacturing, the materials used in it, the way it is stored, because these are all the places where I have identified why the period material is toxic and why it is causing health harm to me. So the same way the period material is doing it for me, period pad or period panty, diapers also have same period panty like materials, and because of which diapers can also cause health harm in children and adults, elderly who use diapers. And here is where I am going to discuss the next case, which I believe in the next case this was involved. This needs to be investigated because it is a public health related concern as well, because what happened to these babies can also happen to anyone else also in that area using these materials. That's why again a deeper scrutiny of this case is needed. So in my previous video, I kept saying Nicole whenever I was discussing Uriel baby's case. So I went and searched on Google on Nicole infant death. And as soon as I searched in Google about Nicole infant death, the case that came up, I presumed that it will be like baby Uriel, some baby Nicole will come up in the story. But it turned out that it was not a baby Nicole that turned up in the story, but it is an adult woman Nicole who has now been accused of, who is going to be prosecuted for murder of 2 children, 2 infants. And if you read the whole story, I will link it here as an example. The salient features of the case is this. This girl was a PhD student in California doing clinical psychology. So being a clinical psychology PhD student, even if you're not a medical doctor student, in like I said before that I've worked with people of PhD streams in multiple fields. I've never worked with a clinical psychologist. But even though I have not worked with clinical psychology, I had a master level program and bachelor level program where some psychology related work I have done, because it was part of my program's thing. So I understand partly what a psychology student studies. I have had interest in psychology in the past also for other reasons, because of my own health reasons. So even though I don't understand deeply like the 100% work a clinical psychology student will be doing, I have a brief picture of 20-30% level work that a psychology and a PhD student does. And a student who is relevant to healthcare field will be doing. I have a even better picture because of so many friends in healthcare of different healthcare disciplines who have worked as PhD students, who I have interacted with in different disciplines of my life. So in the study discipline as well as the work discipline. So I know that even people have this perception that which is a general perception of many people, that if you do not work, if you are not a medically certified doctor, you cannot know medical things, which is the paradigm that first I want people to let go of. That if you are not a medical doctor doesn't mean that you are not familiar with many aspects of healthcare delivery or many aspects relevant to health. So, and even though she is a clinical psychology PhD student, so firstly people being a PhD student start thinking you are not a medical doctor, so you cannot understand things that medical doctors know. False paradigm. You can still have some overlap in teachings which will show that a PhD student can also have a lot of knowledge about medical things that a medical student has. So that is first paradigm people need to let go of. Second paradigm, to understand her case deeply, to let go of that belief system. Second belief system, she is a doctor of, if she had finished her PhD, she would become a doctor of clinical psychology, so which is about mental health issues, right? And her topic and thesis is about mental health, that is mentioned in that paper. I haven't gone and researched her research work, because if she has got some publications, I can go and even check her up about her, what kind of research work she has done. I can do that detailed insight about her. But I'm not going there yet, because this general insight about her is enough for anyone looking at her case to understand her better, but you have to first let go of certain perceptions related to her and her study and her area of expertise. So firstly, she can have similar knowledge or some different knowledge being a new student about some modern healthcare related things that are influencing people's health, that even though she is a student of clinical psychology, meaning mental health, she can still have information about physical health things as well as part of her study program. Does that make sense? So just because she's studying more on mental health doesn't mean that in her field of study, if she's a good student, and because she's a PhD students, when we do PhD research work, we can go on in this rabbit hole journey of also studying other ancillary medical field related work as well. It just depends on how good a student you are, how interested a student you are, and even if that topic may not be related to your field of direct application and work, you can still have some ancillary application related to that field, which might be important. Because what happened in the paper, as you will, newspaper article that I'm referencing here about her, she was a PhD student who had gone to visit some family friends, similarly like how I have done in my past, and that's why I understand part of her journey. And she went and stayed in her she was living in a Airbnb in Pennsylvania, and then she had also visited this family friends and she was staying with them. When she stayed with them and spent a few hours with them, at that time maybe they might have asked her help in, because they had twins at that time, so taking care of one child is difficult enough, but when two babies are there in the home, it is even more overwhelming to take care of two babies. So at that time, let's say the father it's a typical family where the father is busy with work, mother is at home taking care of two babies, and let's assume she's the friend of the mother. I don't know who she's friends with, whether she knew both the parents, that detail is not given, but it doesn't matter. I have visited people where I am friends only with the women. I've also visited family when I have friends or family with both the people in the family. So at that point of time, whoever you know, you will spend time more with the person you know, but if you knew both of them equally well, you will also spend equal time with both the parents in socializing and helping them out if they are new parents. Obviously, if you are a helpful person, helpful friend, you will be helping them out as well. So maybe when she was asked by the mother if there are two babies now who need diaper change, luckily for me, none of my friends ever asked me to do diaper change of their kids. But because I had worked in a preschool, I have done diaper changing and I am familiar with the things you need to do for diaper changing a child. So a toddler, I've diaper changed a toddler, I've not diaper changed any infants, but understand that the procedure for diaper changing an infant and toddler will be more or less similar. It's just that with the infant you might have to be little bit more gentler, little bit more softer, and you have to do most of the work. Whereas with a toddler, if the toddler is walking talking age, they might sometimes be naughty and not want to sit still, but you can have that conversation with the toddler, can you sit still, or you need to distract the toddler. Because I've seen my friends, even though I didn't help them with the diaper change, while they were diaper changing, once or twice one of her toddlers was very squirmy. So either her husband or when the child was at the squirmy stage, her husband, or if I was the friend available, sometimes we had to distract the child with showing a video to the child or hold the child's hand so that the child is not getting squirmy. So this is what we used to do for one of my friends' kids. For other friends' kids, I never was involved in their diaper changing. When I changed a diaper for a toddler, if the toddler likes to chat, I would chat with the toddler. If the toddler doesn't like to chat, very quietly I just do the diaper change and that's it. And again, my whole set of diaper changing I can count in one finger. That many times I have done any diaper changing for a kid. But because I had the period problem with the period pads, which are very similar to diapers, period panties, I know the rash like things that a period material or a panty material can cause in a child. And also in recent years, clothes material have also been giving me rashes and health concerns because of the chemicals in the clothes, the dyes used in the clothes, not just clothes like this top or kurta or whatever dress I'm wearing, but also clothes like bed sheets, clothes like jeans, clothes like panties and underwear. All of them, if they have high chemical content in them, my skin is reacting to it continuously. And I've given my patient history that I potentially have some organ damage and cancer like things and circulatory system related things developing in my body. My body was also showing beginning stages of some liver toxicity and kidney toxicity in one of the blood tests I had done previously, but it was in a very beginning stages. So it would not be in a diagnostic stage of you have definite liver toxicity or definite kidney toxicity. But kidney toxicity and liver toxicity increases when our toxic content in our body increases. So like in the case of baby Nicole, where I have mentioned how her redness of her skin and some other symptoms can indicate some medication accumulation was going on and adverse reaction and toxicity to the medication was going on in her body potentially. And with baby Nicole, Uriel, while with I again said Nicole possibly, but with baby Uriel, while multiple set of chemicals could have impacted her health, for some people it can be multiple set of chemicals in their body giving rise to some organ damage manifesting or skin symptoms manifesting in their health, while for others the organ damage would be slowly manifesting where the person looks healthy. Do I look very healthy? So will you, if you have no context about my blood reports, no idea that I have done some blood tests, no idea about the functional health status that I am in currently, you will assume looking at my videos that I am physically very 100% fit. And this is how many people who have organ damages can present to a doctor also. When you go to a doctor, when the doctor has no context about the symptoms you are manifesting, doctor has no medical report about the symptoms you may have in your bloodstream and body's own diagnostic criteria that will tell you that the person is sick, and if the doctor's level of understanding about those measures that are coming showing up also in the diagnostic test, if the doctor's scrutiny of that is not complete, in all of these times you will have a partial or incomplete or misdiagnosed picture about the patient's health, which I believe could have happened to baby Ari. So because in this story what happened is Nicole was spending time with Savannah, I think is the mother's name. Possibly she was spending time with Savannah or this family of two parents and two twin sons, and they were only 6-week children. So understand, when a baby is 6 weeks, you're not yet familiar with everything about that baby because you are a new parent, you don't know many things related to new parenting. And finally, what I'm discussing in this video is a very very new thing 99% of the world hasn't had any understanding about, or even if they do have an understanding, the comprehension level about how this manifests in a child's health is not, or even in an adult's health, people do not understand this very deeply. And that is where I'm trying to shed light about an area where people have not understood how this manifests or unfolds in a person's life slowly over time, because organ damage is something that doesn't happen the first day I drink water which is contaminated, or the first day I have a food that is contaminated, or the first day I wear some clothes or diapers or period pads that are contaminated. But repeat exposure to it can add to my health harm. And previously, if for many months I have been drinking water or consuming things that were health harming for me, slowly internally damage was happening. On the outside, the damage was not visible, or it was visible in the form of minor rashes or redness of skin or bruises or tenderness of skin. All these things would have been manifesting on the outside in the form of very negligible looking symptoms, because as I said, internal damage can be much worse than external damage, or external skin is much more stronger and thicker. So if my local water supply is contaminated with some very heavy toxin, while I shower in that and it gets absorbed on my skin, from the skin it will invariably go in my circulatory system, and while on the skin it might lead to very minor rashes or skin irritation, like I'm irritated and scratching my skin or something. Or for some people, if the rash has accumulated in enough level, the chemicals have accumulated in enough level somewhere in their hands or body. Right now I don't know, you can't see it possibly, but few days back I had a rash here also, where my skin was peeling off because some chemical contamination from soaps or soapy water had happened to my hands. Same way, if the drink is also contaminated, I mentioned in one of my previous videos about chemical poisoning, because this chemical poisoning, what was happening is, if this glass of water I am drinking from my filtration device, but my filtration device doesn't have the capacity to filter out some chemical toxins that my local water supply has, this water will, even though it looks quite crystal clear, it's not crystal clear, and that's not a glass of water, but let's say this bottled water. This bottled water's filtration system mechanisms cannot clear out all the chemical toxins of the area from which this water is derived. At that time, even though that bottled water looks completely crystal clear, it does have some toxins in it that are not visible to my eye, but which is symptomatically visible to me when I consume that water, when it burns my body, when it burns my urinary tract or urinary system. So in the case of baby Ari, what happened, when Nicole was likely diaper changing, or maybe the mother asked after taking a shower whether she will help in make, when two babies are there, you always want another person to help you if possible, right? So, the parents might have asked her to help in changing the baby's clothes when maybe the baby has sweat, or they asked to help in changing the baby's diapers. So she was likely helping with diaper change, because what she said to the parents was, when she was doing diaper change, she saw blood in the stools of the baby, or either the stools or blood in the diaper. Now whether the blood was there in the stool or urine is not presented in the video, and both of it is relevant. Coming from stool is relevant to show where the organ damage was happening. If it comes from the pee, then it is relevant to understanding again where the organ damage was happening. There is a high chance that the way the thing is mentioned and what else was presenting as a symptom on baby, the baby's penis was also bleeding, she said, and she had taken pictures also of how it was looking. This is the same thing I had done for myself when I was coughing blood from my lungs. I had taken in a glass like this. There was a plastic container like this I had at home, which was a drink container from some McDonald's like place. So I had coughed up like literally this much, like 1 centimeter level of sputum and blood had come up at that time when I was in a heavy coughing stage. Like every few hours or minutes I was coughing and coughing and coughing, and while coughing, blood had come out from my lungs or somewhere in my respiratory organ. Some respiratory organ had ruptured and blood had come out, and it was not something that was coming out from my nose. I couldn't get them to differentiate that how concerning it is if something is coming out from your respiratory tract. Your respiratory tract cells anywhere, like my trachea, it most probably it came from somewhere in the bronchioles or lung regions. Thing had come out because it was a very deep cough. So somewhere in this region, that much I understood, that the blood came out from some of this area, and this area's blood should not come up normally in the form of cough unless you have a deeper lung infection or a deeper lung illness progressing in your body. But the doctor didn't take that seriously. Same way here also, if you ignore what Nicole had found about the baby, understand, again, I am also not a medical doctor, but I am familiar with clinical terminology, I am familiar with clinical things, both because of two different, one PhD program related pharmacology study I had done, one PharmD program related doctoral program I had studied. So I had two doctoral level degree program exposures where I have had clinical related paradigm related understanding of what happens to the human body when, and even if I didn't have a full doctoral degree program, the master level degree programs I have and the bachelor level degree programs I have, all of them also have some biology, pharmacology, physiology related studying that I have done, that gives me the insight about this basic things where something is wrong with the body. I have an understanding where something is really wrong. So Nicole was also possibly being a clinical psychology student, if she had before her clinical psychology PhD degree also, if she had a basic, another biology degree as a bachelor student, or another human biology related degree, human anatomy physiology related studying that she has done in any of her degree programs, again, even if she was only studying mental health right now, her past history or her past even information about, even in 12th biology you could have had some exposure to lung related functions that could still, if you were really deeply interested in studying human functions, you may still have that idea when something is wrong, something is wrong. So that's why she took the photograph of the baby, not because she's a pervert or something, or she is interested in capturing people's penis or other organs. But when you are a medical student, also as a medical student, these are symptomatic things that you need to capture sometimes about students. And she's a PhD student, so PhD students document even more data than medical students might document. So as a PhD student, understand her mentality. She is a PhD student, so she would have documented something unusual that was scary also, that needs to be immediately investigated. That's why she told the parents. And the parents also understood that this is something serious, because blood shouldn't be coming out from the penis. Blood shouldn't be present in the diaper of any child, a child or adult. So same thing, like when I coughed up blood shouldn't have been there. I also mentioned in my another video about my urinary problems, where in a chemical poisoning was going on. I know the chemical source also from where the poisoning was going on, but if the doctor level person who is examining me doesn't trust the fact that it's not a simple UTI infection, it's also not simple bleeding that a woman undergoes during reproductive cycle, it is a different urinary problem and not a uterine problem or vaginal problem, that thing I couldn't convince that it is my urinary systems, renal systems malfunctioning that was going on at that time, leading to bleeding. Same way with baby Ari, not Yuri, with baby Ari, when his penis is red and bloody and his diaper is also bloody, if the blood was coming from his urine, understand that some internal organ damage could have been happening with some chemical exposures he is happening. And where are baby Ari's chemical exposures, all of them need to be examined, not simply for baby Ari has died, but also for all the other babies this family might have if they continue living in this home, this family might have if they continue living in this locality and using the same products that they used on baby Ari and baby Leon. They both have died, but they both have died for reasons that need to be investigated in the right way. And actually for baby Ari and baby Leon, the same set of chemicals could have resulted in two different symptoms, because even though they are twins, the manifestation of the chemical damage in their body could have happened in two different ways, and that needs to be explored further and deeply and in the right way. And they can't simply attribute everything to this girl Nicole. She might be responsible for partly for again Leon's death, but I don't believe she's responsible for Ari's death. In fact, she was helping them in understanding what is going on. She has taken the first step to understanding what was wrong with Ari's health, which if not investigated in the right way, and the proof of her innocence, again like with baby Uriel, when I said there are other local circumstances that could impact Uriel's health, same way there are other local circumstances, that home specific circumstances, the products use specific circumstances that were impacting Ari's and Leon's health, that needs to be investigated, because this is again a global mass scale health related challenge and problem that is happening at a local scale right now for multiple set of circumstances associated with their life and life journey on earth. But it is also a circumstance which will impact other future babies of that area, other future babies parents who are using similar type of products that these babies parents used, other future babies whose parents when pregnant were eating some similar kind of had some similar food and clothing and environmental exposures, all of which I discuss again in baby Uriel's case. Many of the things that were responsible for her death or her health harm slowly unfolding in her body are also the same things and similar, same yet different. Like the chemical that might have damaged baby Ari and Leon will be a different chemical, or might be a different group of chemicals. Why? Because they live in Pennsylvania, whereas the other baby Uriel was living in Florida. So Florida specific chemicals were influencing Uriel's health. and Pittsburgh specific chemicals or Pittsburgh specific products were influencing Ari's and Leon's health, along with, in both the babies' cases, the caretakers' irresponsibility or caretakers' less awareness related to certain things, or some caretakers' deliberate malicious intent. All of these can be responsible partly for whatever happened in both these cases. So I'm not denying that Nicole was not responsible in some way for Leon's death, but I believe for Ari's death she was not responsible, and that deeper diving, and for Leon's death also she was only possibly partly responsible, both of which need to be examined further. And here I will close this video because it's already 1 hour. I'll give the details again in a next video related to both babies, and I might make it into 3 if I need to discuss first Ari's case thoroughly and then Leon's case thoroughly. I'll see whether I can make it in within 1 hour video, because I know my videos being one long hours, it can be tiring to understand the material I'm presenting here, but it is crucial for everyone to understand the context that what happened to Ari was 90% more likely due to environmental conditions like baby ureals. Study baby ureals material that I have presented earlier. You can do even more further study. The more detail you want is all presented in many of my videos, but the shortest one I can make is this 1 hour videos of these specific cases. And all this understanding of what is happening in these cases, I can analyze the situation within 15 minutes or 30 minutes of the data I am reading, but to explain it to someone who has zero context about what is going on, it takes me one hour to explain the details to anyone who is not well versed in these things. And I'm trying to educate you about what needs to awaken in your understanding about these things to make you better understand what is actually going on here, because the reality doesn't change if you don't understand it, but the reality will get better and improve if you do understand where things are going wrong. And when everyone involved in anything related to healthcare or child caretaking or birthing a child or nursing a child or doing own self healthcare paradigms, everyone needs to shift certain patterns in our normalized functions in our life, which needs to happen slowly from individual to family level to social level to community level to multiple groups of healthcare taking working together level of functioning. And that's why only I'm making these videos, because multiple levels of healthcare have to wake up, multiple levels of justice delivery has to wake up to understanding not everything is malicious, not many things that are considered as malicious is actually malicious, and many things that were considered as normal is currently right now malicious or harmful. So those deeper understanding of what used to be a good thing to use and is not a good thing, what you are perceiving is as harmful but is not harmful, that difference needs to arise, that correct discernment about what is actually going on needs to arise here, which I will explain in the next 1 or 2 videos. I hope this was informative. Again, if anyone wants to have better discussion about these topics with me, or wants to really find the proof of what I'm talking about, I know how to get the proof. I just have no access to these people. That's why I'm making these videos. And again, what is relevant in baby Ari and Leon's case is also globally relevant for many other babies' cases. I've already made some relevant to their topic discussions in some infant death, kid related videos that I have made in the past, and some in Hindi, some in English. So I've already started introducing this topic. It's not that I'm not working on these topics or contemplating and reflecting on how these topics impact kids' health or any human health condition that I'm discussing in these videos, but general understanding of it is poor, and that's why I'm making the video, to at least give you the awareness of what is going on. And then after awareness and understanding develops, then only the right change can be made to solve these issues in the right way. So again, if anyone wants to connect with me, please connect with me or drop a question or comment here. Thank you very much. Have a great day.